Canada's health ministers are meeting in Prince Edward Island to discuss what many are now calling a crisis in healthcare across our country. Number one, no family doctors for many people. Number two, long wait times in ERs. Number three, not able to get primary care. Number four, waiting long time for surgeries, and on it goes. What's the solution? Health ministers over the next 2 days will be hearing from doctors and nurses who are on the front line in the healthcare system, trying to figure out new ways to attract workers to the healthcare industry, prevent current professionals from leaving, talk about all those credentials that foreign doctors have to have, as well as licenses to work in different provinces. It's pretty complicated. Let's bring in John Philpott. He's the CEO of CanAm Physician Recruitment. They're a leading group that brings in, recruits doctors from around the world. Good to see you, John. Thanks for your time.
Thank you.
All right. You're getting a call there, but we're all good. Tell me a little bit about the severe shortage of what you see when it comes to doctors.
Well, it's there's not one finger to point. There's a couple of major things. The first and foremost was the government's changes to corporate tax rules and eliminating basically family trusts and income splitting with spouses. Now you have doctors that are working for, depending on the province, 47 cents on the dollar. So, the average physician across Canada has been over the age of 55, depending on the province you're in. Sometimes it's higher than that. So these doctors have elected to retire from their practice and continue to do some locum work or telemedicine work that has now been exposed since COVID. So telemedicine is readily available, so physicians are more capable of working from their home and working a smaller caseload. And they're not worried about trying to make $300,000 or $400,000 and pay over half of it in taxes. They're managing a work-life balance, and that's one of the biggest issues. Government has been pointing the finger at COVID. COVID was certainly a catalyst to physicians understanding that they can manage their practices differently. But the overlying rule is taxation. Unfortunately, I think we're going to start to see a major brain drain out of Canada again, like we saw in the 70s and the 80s and early 90s, back into the United States. So it's a very concerning problem, and unfortunately, there's no one fix. When it comes to international recruitment and licensing of foreign physicians, unfortunately, prior to COVID and even during COVID, the licensing rules got to a peak point in Canada for foreign doctors, making it very expensive for foreign doctors to even consider applying for license in Canada. And depending on the province, it was making it almost impossible for them to get licensed in Canada. Now, things have changed dramatically in the last year. Places like Ontario have certainly opened the doors to American-trained doctors, and we're seeing a big influx on that. But I think, one of the biggest issues in retention is certainly taxation.
John, thanks so much for taking a bit of time for us here. Much appreciated.
You're welcome, sir.
All right, John Philpott there in Halifax.